Good morning. My name is Lou Valero, and today we're going to be making some breakfast with the brachial plexus. So first, what is the brachial plexus? Well, the brachial plexus is the nerve innervation of the upper extremity. It is made up of 5 rami, C5 through T1. And these rami join together to make the trunks. The trunks are called the superior trunk, the medial trunk, and the inferior trunk. And each of those trunks later divides, this is the division stage, into an anterior and a posterior component, which later they make up the cords, which is the lateral, medial, and posterior cords. And the lateral cord then branches off into the musculocutaneous nerve and the median nerve. And then the medial cord makes up a part of the median nerve as well, and the ulnar nerve. And the posterior cord makes the ulnar nerve and the axillary nerve. And then these are the 5 nerves that we're going to be making breakfast with today. But I also wanted to talk about the other branches of the brachial plexus, considering that they're still very important. First, we have the long thoracic nerve. The long thoracic nerve innervates the serratus anterior, and this is the muscle that keeps the scapula close to the ribs, and it's one of Dr. Garcia's favorites. The dorsal scapular nerve, it innervates the rhomboids, the minor and the major, and it helps with reaching into your back pocket. This nerve, the subclavius, it innervates the subclavius muscle, which is under your clavicle, but above your first rib. The suprascapular nerve, it innervates the supraspinatus. This is one of the rotator cuff muscles, and it helps with washing your hair. Later in the cords, from the lateral cord, we see the lateral pectoral nerve. And from the medial cord, we see the medial pectoral nerve, and they are connected. And they innervate pec major and pec minor, respectively. Pec major can help you with putting on a seatbelt, and pec minor can help you with walking on crutches. That is their purposeful activities. Also, we see in the medial cord that there are 2 branches. They are separate. They're the medial cutaneous nerve of the forearm and the arm, and they innervate the skin that gives sensation or the sensory input of the forearm and arm, respectively. In the posterior cord, we see the upper subscapular nerve, and the upper subscapular nerve goes to the subscapularis, which can help with toileting and hygiene. The thoracodorsal nerve is very important because it innervates the lats, and that is the large muscle that helps you go from to stand from a sitting position. And lastly, we have the lower subscapular nerve, and that goes to the teres major that also helps with toileting, just like the subscapular nerve. This is the brachial plexus, and now we will be making breakfast with the musculocutaneous, the median, ulnar, radial, and axillary nerve. First off, we have to gather the ingredients. When I grab the bread, I am flexing my shoulder using specifically the anterior fibers of the deltoid, which is innervated by the axillary nerve from the posterior cord. When opening the butter, I extend my wrist using the extensor carpi radialis, which is innervated by the radial nerve from the posterior cord. Next, I prepare my eggs by ulnarly deviating and flexing my wrist, using the flexor carpi ulnaris innervated by the ulnar nerve from the medial cord. To make my morning tea, I pronate my forearm with the help of the pronator teres, innervated by the median nerve from the lateral and medial cords. It's time to eat. I use my biceps brachii, innervated by the musculocutaneous nerve, to flex my shoulder, flex my elbow, and supinate. Yum.